Hi, my name is Tamlin Kelly, and I'm a social worker with Maryland Hunger Solutions, a nonprofit that works to end hunger and promote well-being. Most social workers have 40 or 50 clients, but my clients are the more than 747,000 Marylanders who are food insecure. Today, I'm going to tell you a little more about my work and invite you to help us to hear the Maryland Crunch. First, let's watch a short video to learn more. I hope you enjoyed that video with photos from last year's Hear the Maryland Crunch events. We had a lot of fun. As I mentioned earlier, Maryland Hunger Solutions works to reduce hunger throughout our state. We use 3 strategies. First, we help to spread the word about the reality of hunger and food insecurity in our state, because hunger is often a hidden problem. Second, we seek to improve public policies to reduce hunger and poverty. And finally, we work to make sure that everyone who is in need and eligible for federal and state nutrition programs is enrolled and benefiting from them. Hear the Maryland Crunch is one way that we both provide education about food insecurity and seek to improve public policies. First, let's talk more about food insecurity, what it is, how it's measured, and why it's a problem. Food insecurity means you don't have reliable access to the affordable and nutritious food you need to live a healthy and active life. It's usually measured at the household level, and another way of thinking about it is that if you're food insecure, you have limited or uncertain access to enough food. People often wonder how food insecurity is related to hunger or malnutrition. Food insecurity is when you don't have access to the food you need to live an active and healthy life. If you're food insecure, you're likely to be hungry more often than others are. But hunger is just the way that our body signals that it needs food. Malnutrition occurs when our diet lacks the nutrients needed for proper health and development. So how do we know if someone is food insecure? Well, we have to ask them questions. Some of the questions that are part of the food insecurity screening are on the screen. One example is, in the last 12 months, did you or other adults in your household ever cut the size of your meals or skip meals because there wasn't enough money for food? Another question on the survey is, in the last 12 months, did you ever eat less than you felt you should because there wasn't enough money for food? Another example is, in the last 12 months, were you ever hungry but didn't eat because there wasn't enough money for food? In other words, people who are food insecure may be skipping meals, eating less than they need, or going hungry. And the key here is that there wasn't enough money for food. That's the cause of food insecurity. You may be surprised to learn that 14.5% of all U.S. households are food insecure. In Maryland, that means about 750,000 people don't have reliable access to the food they need to live a healthy life. Food insecurity is especially a problem for households with children and elderly members. Food insecurity disproportionately affects certain populations. For example, 18% of all Marylanders over age 60 are food insecure, and 20% of all U.S. households with children are food insecure. Next, we're going to take a look at why this is such a problem. So, why should we be concerned that 20% of all U.S. households with children are food insecure? Well, the research is clear that children in food insecure households have poorer health outcomes. Some of that research is summarized on the slide. For example, children in food insecure households are 57% more likely to have upper respiratory infections. Teenagers in food insecure households are 5 times more likely to have attempted suicide. Food insecurity is also associated with poor health outcomes for adults. For example, food insecure adults are 2 times more likely to have diabetes. They're 25% more likely to have hypertension, 50% more likely to have kidney disease, and 4 times more likely to have osteoporosis. So, food insecurity has many negative health outcomes for children and adults alike. So, I hope we can all agree that food insecurity is a significant problem. The next question we have to ask ourselves is why? Why does food insecurity exist in Maryland? Maryland is the wealthiest state in the wealthiest country in the world. Why are there 750,000 people in our state that don't have reliable access to the healthy food they need to live a healthy life? Let's take a closer look at what life is like in Maryland. For example, to rent a 2-bedroom apartment in our state, it costs about $1,200 a month. If you have a full-time job and you earn the minimum wage, that means you earn $8.25 an hour for 40 hours a week. That comes out to about $1,400 a month. If your income is $1,400 a month and your rent is $1,200 a month, you're not making ends meet. In addition, if you're disabled, you may qualify for the Supplemental Security Income Program. This is the government safety net for people who are unable to work. The Supplemental Security Income benefit is $733 a month, with an average 2-bedroom apartment renting for $1,200 a month. People are just not making ends meet. So, to summarize, food insecurity is the lack of reliable access to healthy food. About 750,000 Marylanders are food insecure. We also know that food insecurity is associated with many negative health outcomes, and households with children and elderly members are more likely to be food insecure. Finally, we discussed how poverty is the main cause of food insecurity. So far, this has been a pretty sad presentation, but don't lose hope. There are programs that really work, and there are ways we can end food insecurity. Let's take a closer look.